how to get HRT in Belgium and in Holland. Voilà, we zijn vertrokken. Good evening to the TRT and Hormone Optimization YouTube channel. And I am honored to have as a guest today another Belgian, Dr. Thierry Hertoghe. Welcome.
Hi, I'm very happy to be able to speak to your audience and certainly about testosterone and even other hormones. So I'm interested in your questions.
Okay, there we go. I'm very honored because you're probably one of the very few centers in Belgium that really does the HRT as a main topic of. Isn't that right?
Yes, and it's actually 4 generations, so it's already more than 125 years actually that my family is busy giving hormone therapy. So 4 generations of doctors. It was in the beginning only thyroid. And actually, when I came as 4th generation, I added testosterone. I learned it from another Belgian who was very interested. And you probably heard about George de Bled, who wrote a book on andropause. And so initiated me. And then I went also in Denmark to see a fantastic guy who works to reverse gangrene with testosterone. And since then, I never lost the passion.
And what's your specialty exactly? You didn't become an endocrinologist, right?
No. If you're an endocrinologist, that limits possibilities. Most endocrinologists are very good experts for diabetes. They're somewhat lesser experts in thyroid, and the rest doesn't seem to interest them. So I prefer I'm a general practitioner. I started in psychiatry, then I saw so many troubles with these hormone problems with these people with psychiatry. I said, I'll be much more efficient by providing hormone therapy. So I went to work with my father, and there I learned all the basics, but also very, very specialized information.
Very interesting. So, I'm a clinical dermatologist, and I get a lot of patients also interested in fitness, and automatically they're interested in health, in supplements, in good food and diet. And often they also ask me, well, doctor, how to get HRT or TRT in Belgium? And the same goes for Holland, because I even see Holland patients in my practice. I'm sure you do as well. So what to tell these patients, especially men, how to get HRT in Belgium and in Holland? So what should I tell them?
You will be surprised, but it's true. It's much easier to get HRT in Belgium than the United States and China or wherever country in the world. I worked on this a lot. I made even court trials against the Belgian government each time they defended or they forbid melatonin and things like that. And that really has helped, and also the education we gave. So we have a lot of physicians. A lot is not maybe much. You probably have 15 very good physicians and then 30 others who know more. But that in such a small country is quite good. And it's unfortunately mostly in the French-speaking part or in the Brussels part. So that has to be known.
Yeah. So I know from experience, a lot of general practitioners, they don't even know what HRT is, especially here in Flanders. They don't know what it is, and they tell their patients, well, your typical low testosterone symptoms, well, that's just normal. You're getting older. You're 40 years old now, so we don't even need a blood test. So how to go about that? How should the patients get their blood work if their GP is not interested?
Well, you're giving the right information. Patients should get a GP who is able to do it, or another doctor is able to do it. We have even ear, nose, throat experts who are prescribing hormones. We have dermatologists who are prescribing hormones, psychiatrists who are prescribing hormones. So you need to find the doctor who knows more about it. And I've made a whole school on hormone therapy, and we have, I think, more than 450 physicians who have followed some sort of training program, sometimes much longer, sometimes shorter. So we do have listing of physicians, and you can go on our website. It's the hertogmedicalschool.eu, Hertoghe Medical School in one word, .eu, where you can ask information, and I will even give you an email, office@hertoghe.eu, where you can directly ask an information. Now, some people ask us in Russia And in the Netherlands, you won't find physicians who prescribe hormones easily because of the mentality. It's like it's not possible to do something. And basically, it's all possible. And me and the other physicians, I have 4 physicians who are working with me, were always surprised to know why the other doctors are not conscious about that. Because you can see it on physical signs. If you're testosterone deficient, I can see it from, I would say, 50 meters, 100 meters on distance. The person is pale, the hair is flat, and the attitude is less tonic and things like that. Even on the voice, on the telephone, you can hear. So it pours out all the testosterone deficiency syndromes. And once you know, you won't forget. So it's just a basic lack of knowledge and of the importance of the hormones. And also one other aspect. Why there are not so many physicians? They're afraid of hormones. They've been brought up by hormones. They think, for example, that testosterone gives prostate cancer. And only one study ever showed that. There was on one person that had since long no testosterone, was castrated, that then received testosterone, and then he developed a prostate that finally got into cancer. So basically, there's a lot of crazy knowledge, and we have to be scientific. And when we look at the scientific literature, it's overwhelming in favor of a personalized treatment in testosterone for most men above age 30.
Mm-hmm.